In this video, we look at two common and particularly error-prone communication situations: serial and parallel communication. Serial communication through multiple people occurs when information is passed from one person to another and then on to another. It is an unreliable method, but often unavoidable. It is tolerably reliable for structured communication, but for narrative communication it is highly unreliable. It is widely used in healthcare and is one of the most frequent causes of disasters and litigation.
A 35-year-old mother presented to accident and emergency with a sudden headache. She was seen by a registrar. Concerned about the possibility of a subarachnoid hemorrhage, a CT scan was organised. This was normal. The registrar discussed the matter with the consultant, who also saw the patient. The consultant was accustomed to treating headaches and also considered the history highly suspicious of a subarachnoid hemorrhage. He suggested a lumbar puncture. The result was ambiguous, with some blood staining that could have been the result of the lumbar puncture itself rather than a hemorrhage. The consultant felt a hemorrhage had not been adequately excluded and asked the registrar to phone the neurosurgeons. The registrar rang the neurosurgical registrar and communicated a headache with a normal CT and non-diagnostic lumbar puncture. Detailed analysis of the lumbar puncture was suggested, and the results implied that the blood staining was not due to subarachnoid hemorrhage. The neurosurgical registrar then told the neurosurgical consultant that a patient had been referred with headache, a normal CT and traumatic tap lumbar puncture. The neurosurgical consultant did not accept the patient and she was discharged from accident and emergency. She re-presented 10 days later with a severe subarachnoid hemorrhage from which she died. The episode led to a complaint, and in the course of its investigation the two consultants met. It became clear that had the concerns of the accident and emergency consultant been conveyed properly to the neurosurgeon, he would have accepted the patient without hesitation for investigation, and her life would probably have been saved.
Serial communication can kill. Know when it's happening, and if in doubt, pick up the phone to the person on the other end of the chain. Parallel communicating means giving a message to several people at the same time. The method covers both public speaking and group discussion, but it is the latter that is principally relevant to team working. In healthcare, the method is used for team briefing, debriefing, collaboration, departmental meetings, teaching and recruitment. Parallel communication differs from one-way communication in several significant ways. Group discussion is a complex business with a large research literature. Countless words have been written on how to handle committees, groups and teams, usually from the point of view of the speaker. As far as team working is concerned, simply holding group discussions without any specific training or agenda can be a big advantage, but there are certain techniques for making the most of group discussions. Group discussion must be done well to get the best out of a team. The primary rule for team discussion is to communicate both ways with all members of the team. Obviously, it may sound, failure to act on this is common. When addressing the team, what the speaker says should be of interest to as many members as possible, ideally everyone. If there is an issue that is only of interest to a small minority, then if possible, it should be dealt with in a subgroup, without taking up the time of all the team members. An extreme but common situation is where the speaker spends time addressing an issue which is of interest to themselves only and no one else in the team. Speakers who do this find it surprisingly difficult to spot. One good way of dealing with it is to alter the group lead in briefing situations. Rotating the person who leads the briefings helps each member of the group appreciate what it is that the others need to know. As for listening, get input from the quiet members. The different personality types are covered in other videos. Some will speak out in group situations and some will remain quiet. These preferences can be quite extreme. Early research into group communication found that the most talkative member of a group makes 40 to 50% of the comments, and the second most talkative 25 to 30%, irrespective of how large the group is. A quiet group member may sit in silence listening to an issue discussed about which they alone know the appropriate solution and never say anything. Obviously, for the team as a whole, the tendency of quiet but capable people not to speak up is a serious drawback. Getting quiet members to speak up is notoriously difficult, but a good start is not making matters worse. When working with quiet people, give them particular space and pay careful attention when they do speak. Asking a direct question in public can appear threatening, and the person will usually give a bland or non-committal answer. A more effective alternative is to make a private request for an opinion later on. Here is how parallel communication compares with one-on-one. There is a greatly reduced opportunity for feedback. The level of attention of individual listeners is generally lower. Uninterrupted speaking tends to go on for longer. The proportion of what is remembered and retained by listeners is lower, and listeners tend to become bored more easily.